The American Heart Association has published a new study revealing that a fatal heart attack or stroke could be the first sign of cardiovascular disease in some smokers. Joining me now is Dr. Debabrata Mukerjee. He's the chair of the Department of Internal Medicine at Texas Tech Physicians of El Paso. Doctor, thank you for coming on this afternoon. What does this study tell us about the lifespan of smokers versus non-smokers?
Right. So we have known for many years that smoking increases the risk of heart disease, having stroke, having heart failure, and dying. What this study adds is that the first event or cardiovascular event may not be just heart attack or stroke, but when we have fatal heart attack or stroke, people may not get a second chance. And the study also shows that smoking reduces the lifespan of an individual by several years, typically 4 to 5 years.
So is it possible to be unaware that you have cardiovascular disease if you're a smoker?
Absolutely. Whether somebody is a smoker or not, sometimes cardiovascular disease can be silent. People can have blockages and may not feel the pain. This is particularly true of older individuals and those with diabetes, but even young individuals may not feel the discomfort, so people may be unaware. Or sometimes if you're young, you may just chalk it up to being musculoskeletal pain or reflux pain and ignore that. So it is certainly possible to have silent myocardial disease.
So what are you telling your patients about smoking and heart health?
So for one thing, we always ask every patient whether they smoke. And I reaffirm to my patients, even those who are not smoking, that certainly smoking is an independent risk factor for developing cardiovascular disease. It leads to blockages or coronary artery disease, blockages in the brain, cerebrovascular disease causing a stroke and cause heart failure. It also increases all-cause mortality, and it is also dose-dependent. So somebody who smokes 20 cigarettes is going to be at a much higher risk than somebody who smokes maybe 4 to 5, but any smoking is bad.
Dr. Debabrata Mukerjee with Texas Tech Physicians of El Paso, thank you so much for coming on the show today.